I am Dr. Asha Kishore, Senior Consultant in Neurology and Movement Disorders Specialist at Asha Medcity, Kochi in Kerala. I've been involved in the care of patients with Parkinson disease who were treated with deep brain stimulation for the last 20 years or so. So Parkinson disease is a neurological condition that produces abnormal movements such as slowness of movements, shaking or tremor at rest in the hands or legs, stiffness of the muscles of the hands or legs, and as the disease advances, difficulty in maintaining balance. So in Parkinson's disease, there is a steady decline in the level of dopamine within the brain, and when it falls below a critical level, patients develop the classical movement-related symptoms of Parkinson's disease. Parkinson's disease is a progressive condition, and unfortunately it is not totally curable, but medical treatment is able to provide excellent relief of symptoms and patients can return to normal functions of life. But this excellent relief of symptoms with medical treatment lasts only for about 3 to 5 years. When they take the medications, these symptoms completely subside, but unfortunately, a new set of abnormal movements appear in patients on long-term treatment. And these abnormal flinging, dance-like movements affecting the whole body, they are called drug-induced dyskinesias. So deep brain stimulation is a treatment that is offered to patients who start showing these kind of response fluctuations, oscillating between being good and being completely off and disabled, or experiencing side effects of drugs in the form of a new set of unwanted involuntary movements. DBS is also highly effective for patients who have severe tremor or shaking of the limbs, which is not responsive to treatment. And these patients can be offered surgery even quite early in the course of the disease. So deep brain stimulation involves electrical stimulation of these circuits which control movement. And this is done through 2 very fine electrodes which are placed within the brain through holes in the skull. This form of neurosurgery is called stereotactic surgery. The source of current is a sophisticated pacemaker-like device which is implanted beneath the skin of the chest under the collarbone. So the electrode inside the brain and the device which is placed on the chest wall are connected by extension cables which run under the skin of the neck. So during the surgery, the exact depth and the direction in which the electrode has to go to reach this deeply located areas of the brain is decided by the MRI of the patient and using sophisticated software programs to decide the trajectory. During surgery, the accuracy of placement is further verified by the neurologist by taking electrical recordings from the brain as well as evaluating the response of the patients to a test current that is delivered. So right on the operation table, it is possible to see the relief of symptoms in the Parkinson's patients and also understand whether electrical stimulation will produce any undesirable or unwanted side effects. So during this phase of implantation of the electrode, the patients are generally awake. After this, they are given general anesthesia and the pacemaker-like device is implanted on the chest wall. Patients have to stay in the hospital for about a week, after which they are called back 2 to 3 weeks later. At this time, the neurologist will start the system and set the electrical parameters of stimulation and adjust the drugs. So it's a fine balance between electrical stimulation and the dose of drugs which give the patients the best clinical benefits. The results are best when it is delivered by a multidisciplinary team which has specialized training in the application of deep brain stimulation for the treatment of such conditions. So the greater the experience of the team, the better are the results.